Hello, my name is Kathleen Lusson. I am a lymphedema therapist, and I also have training as a health coach and a meditation teacher. And I would like to talk about the link between autoimmune diseases and mindfulness. This is kind of a quick introduction for my fellow mind-body professionals. So first, let's start with a definition. What are autoimmune disorders? Because focusing on the fact that the clients that are coming into you may have an autoimmune disorder. So autoimmune disorders are a group of conditions in which structural or functional damage to the cells, tissues, organs, or organ systems is produced by immunologically competent cells or antibodies against the normal component of the body. So it's kind of like the body is attacking itself. And when they go to a doctor, their treatment will usually include education and pharmacologic management of physical symptoms. So the interesting question is, especially if you are a health coach, if you are a meditation teacher, can we support what their doctor is doing and also offer them some evidence-based mindfulness practices? So can mind-body professionals help clients with autoimmune diseases, and what does the research show? So authors from the University of Virginia School of Medicine, they reviewed 21 studies, and they found that non-pharmacological treatment can positively impact psychological functioning as well as biological markers, and thus may be used to complement standard medical treatment. So this is exciting. Specifically, how does mindfulness help with autoimmune diseases? So mindfulness-based interventions are aimed generally at the reduction of psychological symptoms of distress and enhancement of quality of life. So we're trying to reduce symptoms of distress and increase the client's quality of life. And they can be include cultivating the mental quality of mindfulness, like open-minded, flexible, and non-judgmental awareness of whatever is happening at every moment of their perception. So we're talking about the styles of mindfulness that focus on non-judgmental awareness. And the objects of mindfulness can be both direct and pre-reflexive perception. So that could be somatic, interoceptive, it can be kinesthetic, it can be proprioceptive experiences. So what that means is that, your meditation can focus on bodily sensations, your meditation can focus on movement, your meditation can focus on awareness of breath. And mindfulness can also include internal psychological states, just a more increased awareness in the client of their feelings, the thoughts, the images that are coming to them, as well as external stimuli through the senses, so sound meditation and stuff like that. So basically a lot, if you're a meditation teacher, this will, you'll be like, oh yeah, like I can see how my meditation practices can address each of those ways. So in their review of current literature on treatment with MBSR, adapted versions of MBSR or MBCT, and then the MAPS, which are different styles of contemplative interventions, the researchers found that patients suffering from autoimmune disease, processes or symptoms, they found a correlation in the study. So when they did these mindfulness-based interventions, in the majority of the studies that they looked at, the people who did the mindfulness-based interventions found biomarker changes. So there was actually a change in the patient's biomarkers, and they also found an improvement in psychological functioning. So, and those two, like, that's very important. And we can ask our clients, like, would this be important to you? Would this be of value to you? Can I share a mindfulness-based intervention that may have these results for you? Because it was shown to have similar results for people in these studies. So the authors state that there appears to be a general consensus regarding the psychological benefits of mindfulness-based interventions, and it's correlated with improvements in the occurrence of negative emotions, including anxiety and stress. And they were also having increased experience of positive emotions, which is they felt more optimism, they felt more supported, and they felt like they were had better coping skills in a variety of treatment lengths and variations. So several different ways to introduce mindfulness to different patients and different studies, and they found that this correlation existed. So they had an improvement in the occurrence of negative emotions, so less negative emotions and more positive emotions. So is there a link between autoimmune disease and childhood trauma? So if you've listened to me, if you've seen me on social media, you know I'm very active and very vocal about adverse childhood experiences. And adverse childhood experiences include child abuse, emotional, physical, and sexual abuse. It also includes neglect, so physical or emotional neglect, and it includes several household challenges. So someone in the household was incarcerated, someone in the household had mental illness, someone in the household had substance abuse. There was intimate partner violence, so the mother in the house was abused, or the parents were separated or divorced. And this happened to our patient before they were 18 years of age. That counts as an adverse childhood experience. And getting very specific about what we're talking about is important, because then I can show you there's a dose-dependent relationship between one of those things happening and the incidence of autoimmune disease when the child is an adult. So researchers looked at the level of adverse childhood experiences in adults with autoimmune disease. It included the following autoimmune diseases: Addison's disease, autoimmune hemolytic anemia, autoimmune thrombocytopenia purpura, celiac disease, dermatomyositis, Graves' disease, Hashimoto's thyroiditis, idiopathic myocarditis, idiopathic pulmonary fibrosis, insulin-dependent diabetes mellitus, irritable bowel disease, multiple sclerosis, myasthenia gravis, pernicious anemia, psoriasis, rheumatoid arthritis, scleroderma, Sjogren's disease, systemic lupus erythematosus, vitiligo, and Werner's granulomatosis. So all of those, what a mouthful, right? But they looked at all these different autoimmune diseases, and they found that the likelihood of a first hospitalization for any autoimmune disease was higher among adults with 2 or 3 or more ACEs compared with adults with no adverse childhood experiences. And even more profoundly, for every increase in the ACE score, so they had one more ACE, for every increase in the ACE score, the likelihood of a first hospitalization with any autoimmune disease increased 20% for women. So every additional ACE, 20% higher increase in hospitalizations for autoimmune diseases. And this is, to a lesser extent, it's a 10% increase for men. So these researchers, looking at this with a large study, a large amount of patients in this study, concluded that childhood traumatic stress increased the likelihood of hospitalization with a diagnosed autoimmune disease decades into adulthood. So this is very important. If you're seeing a client and that client has an autoimmune disease, we need to keep in mind that there may be underlying adverse childhood experiences. And if you as a professional are regularly helping people with autoimmune diseases, this has to be on your radar. The idea that we can't just focus on symptoms of one specific disease, like just in that silo, and not ignore and end up ignoring the rest of the body. So there may also be some stress reduction, evidence-based stress reduction interventions that we can offer to our client, that we can suggest, that we can have them go and research, that we can just, in the very least, I believe people with autoimmune disease, at least let them know, let them see the literature and take that back to their physician. And just have an idea of that this may be a player in what's going on with their autoimmune disease. So the good news is that mindfulness is indicated to help reduce the effects of adverse childhood experiences as well as autoimmune diseases. So there are several research-based strategies for helping clients with stress reduction, and these include fostering healthy relationships, improving sleep quality, ensuring balanced nutrition, encouraging regular physical activity, sharing mindfulness practices, increasing time spent in nature, and if it's necessary, we can provide a referral to professional mental health care if it's needed. So if I share one thing with you that you learned from this video, that there is indeed more than just pharmacological and education that we can give and reinforce what the doctor is doing, and that we can also add on and layer in these stress reduction practices, and it makes even more sense to do so if our clients have autoimmune diseases and a history of adverse childhood experiences.